Morning, everyone, and thank you so much for joining us on this Friday morning. My name is Tiffany Narvaez, and I'm part of the marketing team at UnitedAg. Before we get started, I want to give a brief shout out to our sponsors who make all of our programming possible. We have CVS Caremark, Elite Medical, HCP National, Plantel Nurseries, and Saim. Thank you so much. Today's webinar is a little different. It's podcast style. And there's nothing wrong with your screens. If you don't see a slide changing, that's normal. That's supposed to happen. Please chat in your questions and we'll answer those at the end of the webinar. If we don't get to all of your questions, we will answer those via email. And without further ado, I leave it to Dr. Rosemary Ku, Chief Medical Officer of UnitedAg.
Thank you so much, Tiffany. Today, we're very lucky to have a special guest here. His name is Joseph Souza, and he's an expert in the substance abuse and addiction field. In fact, he's been working in this field for 20 plus years, and he's also a local in Tulare. He actually grew up in Dinuba, California. Joseph is a certified addiction specialist, as well as a certified drug and alcohol counselor. And he currently works as a mental health rehabilitation specialist at an amazing residential treatment program called Courage to Change. Courage to Change is located right outside of Exeter, California, and specializes in helping young adolescent men recover from a life of having mental illness, addiction, and also gangs. Joseph, thank you so much for joining us today. We're very lucky to be able to pick your brain.
Thanks for having me.
Wonderful. So as you know, the COVID-19 pandemic has created an unprecedented amount of stress in society today, and a lot of people are turning to alcohol and marijuana to cope. Now, for those who are of legal drinking age or are able to use marijuana legally, is it okay for them to use these substances to cope?
My answer would be no. And going back in the day, these are gateway drugs that could lead to dependency and make matters worse in your life. If you use on a daily basis or a weekly, it could end up being a habit. My suggestion would be try exercise, or sit down and speak to a health professional about it, a doctor. But exercise for myself, speaking personally, has always been very helpful for myself. I have a high stress job, so getting help, talking to a loved one, exercise as much as you can on a daily basis.
Guys can help with a lot of mental and physical health issues during this time. Now, Joseph, you mentioned that if people start using these to cope, it can develop into a habit. What is the difference between healthy use of, say, a substance like alcohol and unhealthy use? And what are some red flags that people need to watch out for, both in themselves and also their loved ones?
Okay, so for women, you drinking no more than 3 drinks per sitting, and no more than 7 drinks per week. For a man, it would be no more than 4 drinks per day and no more than 14 drinks per week. And some red flags that you can look out for would be these. You could ask yourself or ask the person you're concerned about is these questions: first of all, do you drink because you have problems? Do you to face up to stressful situations? Do you drink when you get mad at other people, your friends or your parents? Do you often drink alone rather than with others? Are you starting to get low marks in school? Are you avoiding going to work or leaving early to drink? Do you ever try to stop or drink less and fail? Have you begun to drink in the morning before school or work? Most of us will get up in the morning, have a healthy breakfast, a cup of coffee, maybe some orange juice, and head off to work. If you find yourself in the morning, going for a drink of, whiskey to get going or a beer, that's a big red flag that you need to look into. Another one is, do you ever have loss of memory due to your drinking? Do you avoid being honest with others about your drinking? Do you ever get in trouble when you were drinking, such as DUIs, or are you getting written up at work for not completing all of your assignments? And the last one I would say is, do you often get drunk when you drink? If you get drunk every time that you drink, it's a serious problem, and you need to look into that. Huge red flag. Huge red flag.
Hmm. And Joseph, thank you for talking about the limits on what's considered healthy versus unhealthy, and also providing all those red flags. Now, why are there limits? I mean, why can't women drink, much more than 7 drinks a week, or why can't men drink much more than, the 14 that's recommended per week? And why is that? What are the short and long-term consequences?
Well, you know, when you go out for socializing and having a drink with friends, I would say if your main concentration is to go to that party to drink, then that's a red flag. We're going there to socialize. I see a lot of people that maybe go out and, if you have more than 7 drinks, like for a woman, um, you could start having trouble in the long term with your liver, heart problems, high blood pressure, and it's the same for men also. Um, you know, Leaving work early to have a drink is a huge red flag. Um, the health problems could range anywhere from, like I said, they could be stroke in the future, heart attack. Um, so you have to be very careful about the drinking more than your limit.
Hmm. Got it. And Joseph, so your experience is very broad. It's not just alcohol abuse, but it's also with other substances as well. And we're so lucky the fact that you actually have local experience geographically, where UnitedAg has a lot of employers. In your experience in our communities, what are the most common substances you've seen abused, and how have you seen that affect families and the people around them?
Well, as far as drug and alcohol counseling, I've been doing that for over 20 years, but for working with high risk youth and families, it's closer to 30 years. And in those 30 years, I can tell you that the main drug that I see used is alcohol. And I think the reason why is because in some families, it's okay to drink, as long as you stay home. Uh, or, as long as your family's around, you want to have a beer or so, or a glass of wine. Other drugs that I've seen in this area, marijuana, cocaine, and methamphetamine are on the rise. Um, Also, prescribed medication is being abused heavily in the area. Um, Kids that get prescribed, for example, they call them promethazine, for example, for a cough. Uh, this is known on the street as lean, and it's also called, like, street names is purple drank, water. And kids will actually buy this. I've seen kids that'll buy this. They've told me they bought this on, like, Craigslist, and then they'll use it. And then if they don't use all of it, they'll share it with friends. And what it is, it's coating with cough syrup. So there's a high possibility that you can overdose on this drug. Um, the impact on the families is devastating. So, families have been torn apart. A lot of families don't know how to get help, or they're ashamed to get help. But I've seen a lot of families torn apart by alcohol and, prescribed drugs at this time, which is on the rise.
Hmm. Joseph, in your experience, have you noticed common risk factors either in youth or adults that make them more prone to use these substances? Does it vary by the substance, or are there other patterns that make someone more high risk of this?
Usually, if you have a family that has, like, only maybe one mother or one father that's caring for the whole family, it seems like the mother or the father are very stressed out, so they might drink more. There might be a lot more physical abuse in the home, verbal abuse in the home, and that not only affects the parents, but also affects the children, because they'll go out with their friends, and use marijuana to get high, or drink and get drunk to forget about these problems. But, the next day the problems are still there. They're doing it the wrong way. They should actually be going to, family parenting. The parents should be taking the kids in and getting therapy for all the family. Because if not, in the long run, it's just going to get worse and tear the family, apart more.
That's really interesting. So it's not in an individual issue, it's really a multi-generational family and maybe a community issue as well.
Well, like for example, in the Native American, families, alcoholism is very high. Like for example, in the reservations that we have surrounding us, I would actually work with some of these kids that live in these reservations, and they say, drinking is very common for them. Every family, most of the families drink, and the children also drink because it's just a thing the family does together, and they don't see a problem with it. But once they do start going to juvenile hall or to jail and getting these big fines and losing their freedom, then they start thinking, maybe I should be doing something else rather than drinking.
Wow. If someone sees that kind of behavior in either themselves or other people, maybe a loved one, how do you address that with someone? Because it can be quite sensitive, right? And especially if the person who's engaging in that behavior thinks it's normal or okay, they might feel offended. How do you think we can help others if we see that type of behavior?
Well, I think the first question that you have to ask is, are they willing to get help? Because you have a lot of people that have problems, but if they're not willing to get help, then it's probably not going to work. Uh, for some of you that aren't familiar with the 12-step program, the first step in this 12-step program is that they have to admit that they have a problem, and then they move on to the next step and so forth. But some of the things you need to look at is if you have a loved one that you are concerned about, is ask them, maybe is their health being affected by this? Ask them certain questions about their health. Do they still have the stamina that they used to have, when they were younger? Getting them support. Like I said, first of all, if they say they have a problem, admit it, then maybe talking to a counselor. And there's many counselors here in Visalia, in the area here in Tulare County. They could speak to a minister, a priest, a spiritual leader. Go in and get assessed, talk to their doctor about it. So there's many people that can talk to you about that.
Wonderful. And do you think there's anything we can do in the ag community specifically to prevent substance abuse and addiction?
I think the number one thing for everybody, just like we're doing on this webinar, is educating people, having more seminars available. Once this COVID goes away, or if it ever does, and we're able to get back where we can have, conferences on it and bring in guest speakers, possibly bring in people that have, 20, 30 years of recovery, and let them tell their story to the public, and they can say how they got their help. But I would say education is the number one thing. Having guest speakers at these conferences, giving the family the resources that they need, having flyers with AA or NA meetings available in their area. But I think education would be my number one guess on that.
Great. And in your decades, like actually 3+ decades of working in this field, were there any surprises? Did you have any learnings that really kind of took you by surprise in your experience with working with these folks?
I have many. I ran into a resident that I used to work with back in the 90s, and he recognized me. We talked. I asked him how he was doing, and he had told me that he had, I believe, 5 years clean and sober. And I said, well, how did you do it? And he says, well, I started attending AA and A meetings. And I said, but we had told you about that back in the 90s when you were a resident at the home. And he said, yeah, but when I was there, I really didn't pay attention to anything. So, as I became more mature and I, ended up going to jail for a while, he says, I got out and I met a friend that was involved in NA, AA, and he actually owns his own electrical company now, which I commended him on that. I said, excellent, you're doing a great job. But I think one thing that when we're working with youth, and it could even be adults, is that, if we explain to them the negative consequences and talk to them about things that they may not know, it's called planting the seed, which I'm sure a lot of you heard that term. They might not use that information in the beginning, but as time goes by, they might say later, I am going to a meeting or getting on a webinar and learning more about addiction so I can help myself and my family.
I love that story because it really shows that people can change, even if it takes a very long time. People can change their life, and sometimes they need an aha moment to trigger that. But as long as they still have that support and resources, then they can actually, once they're ready, they can access those. So that's wonderful. Are there any other stories you'd like to share with us, Joseph?
Oh, there's so many, and I remember we had a resident again back in the 90s that we had a kid that he was trying to change. He actually was alcoholic, and I want to say he was alcoholic at a young age, which is very surprising because it's not easy to become an alcoholic. But after heavy drinking for many years, you can be. And I think he started drinking when he was 10. And his mother came to the family conference that we had. And as soon as she walked in the room, I could smell the alcohol in her breath. And to me, that was like, wow, your son's trying to get help. And here he is with 5 or 6 months of sobriety. And the mom comes in with alcohol in her breath to a family meeting that was supposed to be for the benefit of the child. So, that's something that was shocking to me at that time. I was young in my profession, but I just thought that was really unusual of her to do that. But addiction is a very unusual thing.
Absolutely.
I have some more I'd like to add.
Yes, please, Joseph.
I want everybody to understand that addiction does not discriminate. It does not care what age you are or ethnicity. It doesn't care if you're rich or poor. It doesn't care about your education level. I've known doctors that have used and I actually met a doctor that was a heroin addict, if you can believe that. And I was like, I never thought of that, but I go, how can a doctor be a heroin addict? You imagine a heroin addict, you see somebody in an alley, that's homeless and has tons of, ingestion marks on their bodies. But what he had told me was he could have his own dosage and enjoy it and not have any consequences from it because he knew all the bad things about it. And I just thought that was very interesting, that talk him and I had. And I met him in Fresno at a seminar, and somehow we got to talking, and I told him I was a substance abuse counselor. But I did talk to him about meetings and where he could go and people he could talk to. But I just found that a person with such education could be doing that to themselves. Doctorate degree, who would ever think? But like I say, it doesn't discriminate. And the thing about addiction also is that if you do get clean, it'll wait for you. You could be 20, 30 years and you're having a very stressful day, and it'll talk to you and say, hey, come and have a drink. I can make you feel better. So very patient, very conniving, but it can be overcome.
Wow, yeah, it's amazing how powerful addiction is, because that example that you gave with the doctor, that person was able to completely rationalize why it was okay to use heroin, right? The excuses that people come up with in their own life to tell themselves that it's okay is really powerful, and to be able to rise above that, and especially to maintain that, is something that requires outside help. Now, what do you think about people who say they can do it alone? Is that even possible?
If I've heard people say that they go cold turkey, but the stats aren't high on that. I mean, you might have 1 out of 100, if that, that could get clean and sober. I would, in the time I've been doing this, it's, and people are afraid to ask for help. And what I would tell you is don't be afraid to ask for help. The first person I would talk to be your doctor, let them know what's happening, what you're doing. Everything you talk to your doctor about is confidential. They could give you resources in your area to go to. But I would say ask for help. You know, if you're a husband, ask your wife to help you. You know, if you're a woman, you know, a wife, ask your husband. Ask for help. You know, don't be afraid to ask for help. Going at it alone, the odds aren't good.
Yeah, exactly. And especially during the pandemic, people might not feel like they have those in-person resources. And on the screen here, we have a link to intherooms.com, which is a remote way to support people with addiction and substance dependency. Joseph, tell us more about In the Rooms.
Yeah, this site here is wonderful. I found this about a month ago. Many sites out there on the web, but this one here, get a chance, go in and check it out. In the Rooms is a free online recovery tool that offers 130 weekly online meetings. So let's say you know, people make excuses. Well, I can't get a meeting because I work all day, I work all night. These meetings are in the morning, they're at lunch, they're at dinner, and they're at night, and they're also on the weekends. Every so many hours there's a meeting, and you could find a lot of different meetings. It's not only alcohol and drugs. There's other. It could be Gambling's Anonymous. It could be Overeaters Anonymous. So go on there. They embrace multiple pathways to recovery, including 12-step wellness and mental health modalities. So I would strongly recommend just go on there and check it out. And you can see actually there's actually people on there that you can chat with. So if you want to go in there and chat with a certain person, you can.
Wow, that's wonderful. Thank you so much for sharing that with us. And before we transition to questions from the audience, are there any other last thoughts, Joseph, that you'd like to leave with us? Or are you ready to go on to Q&A?
I would say, you know, if you're concerned uh, about yourself or you're concerned about somebody else, reach out and get help. You know, could be even your neighbor. Talk to them. You know, it's not going to hurt. You know, if they tell you they don't want to talk about it, so be it. But at least offer that help, open that door, plant that seed. You know, there's nothing wrong with asking for help, and there's nothing wrong with giving help.
Fantastic. Tiffany, I will let you lead it from here to see if there are any questions coming in.
I have a friend that I've been trying to help for a while with addiction. What can I do to help him? Why does he always reject my help?
Well, it's going back to, you know, is he ready? I've been in a similar situation, like I said, with these youth that I work with back in the 90s. I see some of them now, and some of them are clean, and some of them are still using. The odds are very bad. It's like 1 in 1,000 addicts, 1 out of 1,000 addicts, I believe it is, or 1 out of 100. I'm sorry. But don't give up. That's my message to you, is that don't give up, because we are planting the seed, but also there could be a day when this person wakes up and says, you know what, I need to go and talk to you again. I am ready now. I have changed my mind. I am ready.
So, what are some signs of addiction, mood swings, etc.? So, what are some signs that might not be obvious?
Some signs that might not be obvious.
Yeah. Are there any signs of addiction that, so we know all the stereotypical ones, are there some that some people aren't very familiar with that we should keep an eye out for?
Usual, they may look as if they're hiding something. That could be another one.
Okay. How do you help someone who is in denial and who thinks they have the addiction under control? How do you make them see that it's not under control? And how do you make them realize they need the help? Is there any way of opening their eyes?
You know, another thing that you can do is called an intervention. So let's say I have my son with me, and he's not taking everything I say serious, but I still see that he's using. I would probably bring in the whole family, have him come in, sit down, have a round table on it, You know, bring in grandma, bring in dad, bring in uncles, cousins, everybody that's concerned, and let them speak their piece. Maybe even write letters to him, and let him read the letters concerning how he's affecting the family. So that'd be one way I would do that.
How much is too much alcohol on a daily basis? If I drink up your daily, is that considered too much?
Well, going back to the woman is 7 drinks, I believe, per week, and the man 14. So when you're talking about a drink, let's say I sit down to have a beer. As a man, you know, I could sit down and have 3 beers. A woman is a little less. The reason why, because of our body structure. But if you're drinking constantly all day long, every day, then yes, there is a problem, and you need to seek help.
My son is constantly worried about his friend. His mom is a drinker. How can he help?
There's groups that are called AlAnon that you can go online. It might be in the rooms also, AlAnon meetings, and you can go in there and discuss how it is you're feeling and how it is that you can ask for help, and they will give you the resources for the area that you're in.
Okay. So this doesn't only affect the drinker, but the people around them. My home is alcohol free, but yet it has become a problem. My son is very worried and constantly sad for his friend. Oh, I think this is still part of the same question. So your suggestion is for the mom and the friend to reach out to Alcoholics Anonymous and ask them
No,
for advice?
it's called AlAnon.
Gotcha.
That's for the that's not people that are addicted, or it's like for the family members of addicted.
Ah, okay.
That would say that would be my first step there.
AlAnon. Okay. How do you spell that? They're asking.
AlAnon.
Okay. I'm chatting that in. Any other questions? I'm concerned about my son. I'm not sure if he's going through depression or using drugs. How can I distinguish between both? He sleeps all day and he has no motivation.
I would say drug test them. You can buy drug tests at the pharmacy. Take them into the doctor, have them drug tested. If he's going to refuse, then more or less that's probably going to be your answer there, is that he is using. You know, and it's not going to be easy battle, especially if the kid's been doing it for a while. Uh, but you can't give up as a parent. You need to, you know, don't be afraid to check their rooms, check their backpacks, you know, check their pockets. And of course they're going to hate you, but like what we got to do is tough love, you know. So that would be my first step. Sit down, have a talk with them, say, I'm going to have you drug tested, maybe go in and have a mental health assessment done. If you do both of those, that'll be the first steps that I would take.
That is great advice. So we've hit the end of the webinar. If you all have any more questions, please feel free to email them to askdrku@unitedag.org, and we will respond to that, and I will chat that in right now. Thank you all so much for joining us. Joseph, thank you. Dr. Ku, thank you so much. Again, this will be available later on for everyone to watch and to share with your loved ones. Thanks again and have a great week.